I'm looking to hi.
Hey.
Hi, guy.
How's it going?
The truth or pleasantries?
The truth.
Oh, my life sucks donkey dicks.
Sorry, doctor.
You know, it's going horrible. I mean, I feel like crap. I came in the next day with patient advocacy, which is really, in my opinion, risk management. I just, you know, it's just not. I don't feel confident. Let's just put it that way.
How have you done since I saw you Thursday?
My stomach has been nonstop rumbling. I've controlled it by not having it, you know, inflate anymore.
Right.
I'm not, you know, it's not. I can press on it, which means it's not under. You know what I'm saying? It's not tight under
Right.
stress.
Still passing gas?
Little. I had a bowel movement the other day. I haven't had one today. I've been praying and hoping for more relief. That would relieve some stuff. Geez, what else can I tell you?
No,
I threw up a little. You know, it's really funny because it's not like it wasn't like a heavy throw. You know when you're like at the end and you're like retching. That was more what it was. You know, but I've also been under a lot of stress. And I've also been trying to get things done in the house to close up and everything, and moving and lifting things. So that's probably putting some strain
So it
down.
doesn't sound like there's been any dramatic change from what was going on before I saw you Thursday. Is that fair to say?
Except for added stress.
Well, there's that. But in terms of the
It hasn't gotten any worse. If that's what
passing
you-
gas, and it's
Right.
kind of the way it's been. Nothing.
And it hasn't gotten any much better, correct?
Okay.
It hasn't healed itself now.
Okay. So the plan is Wednesday morning. Right? That's still the plan? You're going to come in?
Wednesday morning is the plan.
Or is it going to be Tuesday? Because I spoke to Terry.
Okay,
and they had.
I'm a little confused. What was our agreement?
Well, our agreement was initially Wednesday morning.
No, I mean about trust.
Oh,
Didn't we have a discussion that, you know, in order to trust, to put myself in your capable hands, that we both agreed that this policy would be rescinded immediately?
well, that was on the wish list.
No, doctor. That was between two gentlemen who agreed that an incorrect policy should be,
Yeah, I agree with that.
right, rescinded immediately and everything else. And from what I've heard, like I said, the next day I came in, has the policy been rescinded?
The policy, there are guidelines for the staff now.
Has the policy been rescinded?
The policy, so policies are in effect.
Yes
until-
or no?
The policy's in effect until the policy is changed, so we provided guidelines until the policy.
Doctor, the policy has not been rescinded. So,
Okay, let me ask you a question. Let me
Please.
take over here. So, which policy was Zuckerberg following?
The videography policy, administrative, and I'll get you a copy. Administrative policy 1606.
1606, and you don't have a copy of that?
They're gonna get a copy of that.
Okay. So, and that policy falls in line with the Department of Public Health's policy?
Well, currently,
Or
the
you-
Department of Public Health City Attorney's offices are reviewing both of those policies concurrently.
oh, wake me when it's over. I have to deal with the city
Grant?
attorney. I'm sorry.
Okay, so I can't confirm that without seeing a policy of 1606 or Zuckerberg's policy. But essentially, the agreement was that the policy that was in place, which denied patients the right to videotape,
Is no longer in play.
It's been rescinded?
so
We don't use the word rescinded. It is currently on hold until the amendments are made. And we have provided guidelines for staff in lieu of that.
So, on hold,
Risk management.
on hold, this means they're no longer to follow that policy.
Correct.
Have all staff been notified?
They received that letter that you have a copy of with the guidelines this morning.
Okay, how can I have proof that this has been done?
Well, let me back up. Can I say a real quick thing? I have the proof on my camera that, you know, I went in just 5 seconds ago, and the security guard didn't know the policy. So, you know, I'm
You're Too
Color me
far away from
confused.
me. You're too far away from
Color me confused. Or better yet, color me polka dotted, because once again, it's meaningless words. Oh yes, the policy, and everybody's gotten this. It hasn't been rescinded. The city attorney, I just walked in 5 seconds ago, and the officer didn't even know about it, and it's on this video camera right here, which is gonna go on YouTube. So,
Okay.
what do these words mean? I'm still confused. I have an adjustment disorder. Please explain crystal clearly.
Okay. Let's allow them to
I am.
explain. Okay. So we tested the theory of training being implemented by going to the emergency room with a camera.
Likely you arrived while that letter was being sent. I don't have the timestamp of when that was sent out this morning. Additionally, in preparation of the staff, Terry and I from this meeting are heading to the operating area to notify all staff in person of what the guidelines are, so that Dr. McCursey's operative staff for your surgery on Wednesday will have the guidelines.
Okay. Now, what is Zuckerberg General Hospital doing to ensure that the Department of Public Health's overreaching and overall policy reflect the correct?
Currently, the San Francisco Sheriff's Department attorney, the city attorney, and the DPH attorney who is handling this, along with HR, as there are staff who are on video and on social media, they all are looking at this current policy.
Can I interject something really quickly? It's really interesting that you say that, because if you go back and you look at my videos, you'll see where I dealt with the sheriff's legal, Mr. Nico, regarding, this policy about videotaping. We went in front of Sunshine, I explained everything. Now you're telling me there's all this concern. I also have videotapes of going to the city attorney, same thing. So, it's difficult for this person with an adjustment disorder to feel like he's not getting played.
So, I'm going to go back to the agreement
Correct.
that you two had. And
And it was for trust building. I want that to be crystal clear.
in order for you to put a knife to him, which is a huge thing, and which is a very, multiply that by a gajillion for somebody who
With an
has been,
adjustment.
who has been lied to and appeased for over 20 years, where he has seen no change. Your words were that you were going to have this policy rescinded. So, that is the crux of trust building between you and Jason. Having a policy
On hold.
on hold and not rescinded.
Which means it's not in effect.
That's her allegation.
Okay.
I just proved it was in effect because I spoke with the security guard.
Okay, so if it's, and I understand it takes time, but we need a letter saying this policy has stopped,
I can't provide you
No,
that.
rescinded.
rescinded.
I can't provide you that.
Thank you. We at least asked.
Okay, so that was the agreement. And it has not been met. I appreciate taking down the signs. These are small steps in the right direction, but they're not.
The guidelines that were written and reviewed by the city attorney are meant to facilitate the ability.
Excuse me, would this be the same city? No, please. Would this be the same city attorney that, when I had my initial illegal arrest and denial of emergency services in 2000, and I took them to federal court, they got up and testified and had my case dismissed, and then 6 years later signed a confession admitting fault and guilt for an Impala violation? Is this the same city attorney? Because I can tell you it is. And I still haven't gotten an explanation. So please be very careful when you bring up the city attorney. I not only have the videos, I have the unethical methodology and displeasure of having to deal with more risk management and
Okay.
inhumanity at the
All
city
right.
attorney's
Our goal
office.
is to provide guidelines so that Dr. McCursey and his team could facilitate.
And my
taking
goal
care
is
of
to get
you.
it taken care of correctly. Like me, the doctor, who's
Okay.
a very decent human being here,
Yep.
because I can feel it. I can feel the compassion, but I can feel you tying his hands. He tried to do the right thing. You guys are playing him too. You know, this from a medical
Designed
point
to
of view.
fail.
Bingo.
Okay.
We are on
So-
the same boat.
So Jason,
Yes,
can
please.
I continue?
Yes, please.
Thank you.
I'm sipping it.
Okay, so as I said, these are appeasement measures. When it happens, then he'll believe it. And I certainly support him in that, because I've seen people promise change to no avail and then just, not respond. So at this point in time,
Can I interject one really quick thing?
yes.
When this tragedy happened, and I asked for my records, your qualified, trained, well people such as Karen O'Donnell, such as the AOD on duty, such as Jeffrey Schmidt, the other AOD I saw, all were part of a package that they sent the person at DPH to deny me my records based on what they claimed was a HIPAA violation. I wrote all these people back saying, you're incorrect, let's have a meeting, let's discuss this, let's put this on video. And I was treated like, can I say the word shit?
Yes.
They still haven't made the appointment. Same thing with the Director of Security, Basil Price, who, when I sunshined him for prior denial of emergency services and those videos, I got them almost instantaneously. This time it took 3 months. So I wanted to ask him, what had changed? The policy, the equipment,
Okay.
So once
So-
again, it's just more of the same shit.
Okay. So that being said, we have anticipated the policy not being rescinded, and we have a letter for you, doctor, basically requesting an immediate transfer of care, because it's really simple. I don't know why rescinding an illegal policy is such a big deal. It's common sense. It needs to be rescinded. You've obviously put it on hold. Why not go the extra mile and rescind it and restore that trust? We understand that signage and training takes time. However, your front door people should be first on the list and explained to. That hasn't been done totally, or they don't fully understand it, and feel free to use this morning's clip as a training tool to see that the understanding of the implications of these laws and the lack of training on them result in denial of care. Let me finish. So here's a letter, and I'm going to hand one to you. This basically is this is what you want, yes? A referral transfer of care to another hospital.
Well, someplace I can trust their words.
Which will probably be nowhere, because it trickles down, and
Apparently it stops at the
and the
top.
leader of Department of Public Health,
Mhm.
Barbara Garcia, has not even
That's why I want to go to Stanford.
reached out. Yes, in order to get safe care for Jason with somebody with no history. Because you have plenty of history and should understand that when you make a deal with him, it better happen. Appeasement is not an option, especially at this point in time. And his health has not improved. He has survived despite Dr. Gilb's request to get him on the table that day last week.
Well, speaking about that really quickly, you know it was a cancer diagnosis, right, doctor? That's what he told me.
Actually,
We don't
Macrosy
know,
said
but we're pretty,
99.9996%.
it would be highly unusual for this to be anything else.
And
Here's the second page. Sorry.
he also told me, you weren't there, but he also told me that the letter I brought from my doctor didn't say that it was an emergency condition, which is really surprising. Can I ask a really quick question? Did you guys even have that letter prepared for my primary care doctor for me to take into him to show him that, not only was I correct, but videotaping was correct so that I could rebuild the trust that you guys destroyed when, I told him the truth and he called and said,
So I can't speak to the letter that you requested.
Okay, did Jeff fill you in on
Jeff
everything?
filled me in.
Okay, did you
So
see the,
There was a number of things.
okay.
We wanted today to address a couple of the things, not all of them,
Mhm.
but in order to expedite your care for Wednesday, because our goal is to get you seen and treated as soon as possible. We
I'll
want to
believe that
provide
when I
care.
see it.
We want to provide that care for you, so
Then the
today's
policy would have been
meeting
rescinded.
was an opportunity to meet with Dr. McCursey preoperatively so that he could give you some preoperative instructions as we work to do the other things that you requested, and we're working on those.
I love the
things.
spin, madam. Continue, please.
So our goal again today was a pre-op appointment with Dr. McCursey so that you receive pre-op instructions before returning what I believe was Wednesday for surgery. Again, our goal is to get you seen and treated expeditiously.
So then why wasn't the policy rescinded if that was the agreement? If that is your goal, I just want to correct the spinning. Or ask the appropriate question while you spin.
Okay, so,
Can she answer that? Thank you.
Again, guidelines were written, were reviewed by the city attorney, they were sent to all staff
Does that mean the
To
policy was
serve-
rescinded?
to serve as guidelines until the policy is completely
Okay, so it's a
amended and
mind
put in
game,
play.
it's a word games. Thank you. That's exactly what I meant. It's not English. It's not Webster's dictionary.
You're asking for the policy to be amended. Today it
No.
is not
No.
fully
No.
amended.
rescinded.
No.
He's asking for it
It's
to be
not in play. It is not.
Madam, I already knew that was going to
Okay,
happen.
all right. So, tomatoes, the correct word is rescinded. That is a key word, not a buzz or diversion word. We need rescinded. It's illegal.
Didn't happen.
Okay, so we do need his medical record
So we can get you a copy of the medical record.
and a letter for transfer. These 3 items, and there's specificities in there.
So I can ask Dr. McCursey, do you call to ask for transfer to Stanford?
Are you asking me, have I?
No, I'm asking now in this situation. I don't know.
What was the question?
Do you call Stanford to arrange, and as you're not his primary care physician?
Well, we can make arrangements, or we can try to make arrangements to have his care provided by anybody he wants to. Doesn't have to be Stanford, I'm guessing.
I just read here, it says Stanford.
It said,
Is that
such
I
as.
prefer
Such as.
out of San Francisco DPH's control because apparently,
It says such as, so I didn't know if he.
well, but
So-
anybody out of their control, such as Stanford, which is out of their control.
So you would tell us so that we could call to make those
Well,
arrangements?
let's start with Stanford, see what happens, and go from there. Because I could pick up everything tomorrow and
right? So
drive down there and get the whole package
Good
started.
point.
I'm not trying to put off Wednesday. I'm just trying to be in capable hands. That and
So-
with people who when they say something, I can believe their words. Not mind games, not word twisting, not I'm sorry, apology, not justification, not rational, not excuse me, my compartmentalized responsibility is only X. For that you have to go over here, finger pointing, always knowing that it's going to fail, because of course naturally when you deal with the city attorney, that's always a failure.
So I would like to propose that I come back tomorrow morning at 9 a.m. to pick up the letter of transfer.
So that's why I'm asking, do we write a letter of transfer?
Well, it's not sure what you're envisioning. I can write a letter, it doesn't necessarily mean anything unless we identify a physician. that-
Right, well, I mean, I'm not even sure that would be your department. There's a third request down here that you make yourself available to articulate,
What the needs and concerns are for me
right,
as a
for
patient.
the videotaping and
Yeah, I mean,
accommodation.
We'll help however we can.
That's great.
Okay.
That's reasonable.
In a setting like that, usually it's, the easiest transfer which may not be his liking, would be within the city, simply because I have closer ties to non-DPH people such as over at CPMC or UCSF.
Oh, non-DPH people. Well, that's a possibility. I'm a little confused because isn't part of this UCSF too? Which would mean that
Yes.
DPH does have connectability?
Well,
I'm just confused.
It's
I'm
a
asking the right
complicated-
question
yeah,
again.
no,
There's
it's a
dual
complicated-
appointments, JPA agreements, there's a whole system of intricacy designed to fail.
but to
in
answer your
that.
question and briefly, the city contracts with the university
Right,
to provide a very specific range of medical services here. So I don't work for DPH.
right,
I work for the University of California.
right.
So we could, for example, transfer me to the University of California. Does that stand? Parnassus?
Yes.
You know, and
Might
you
be
could do,
Mount Zion, it might
and
be
you
Mission
could do
Bay,
the
but-
surgery there because you, like you said, you're part of it, or whatever.
Actually,
But you
I don't
know
have-
somebody
I
there.
don't have privileges there,
Well,
but
but whatever the case may be,
I could find-
and they can also meet my requirements that they won't have an illegal videotaping policy and everything else because,
that I don't know.
well, you know, I mean, that's kind of like,
That I don't know. I don't know.
well, I
what
mean,
the
maybe we should check
policy-
on that because if we can get them to do the right thing, which hasn't happened here, let's go. I'm not the one who's holding up this.
So, if I can paraphrase or rephrase.
Yes, please.
That if we can identify a center, be it CPMC or Parnassus or Mount Zion or Mission Bay or Stanford or
Right?
San Mateo or somewhere, that does not have or has a policy that permits
Correct
help me
policy.
here, which-
Correct.
Not an illegal policy, basically.
Right.
Yes, a correct policy.
basically a policy that permits
What a person should be allowed to.
Right.
You know, I mean,
Video-
patients
Videotaping
to
of-
videotape.
Right. Their care and in public areas.
Then if they had a policy permitting that,
Right.
and they had capable providers, which all those institutions do,
Right.
then you would
Theoretically.
be happy having the care transferred to that institution.
yeah, because we wouldn't have to jump through these hoops that you guys didn't jump through.
Right.
Okay, we can pursue that. I don't know enough about,
So I can't speak on the behalf of what their policies are. What we can do is call, I would prefer that you tell us where you would want to go, and we would call those places and let them know.
Hey, I think you just listed 3 or 4. Why don't we
Okay.
call them all to see just how many are compliant with the law?
Okay.
Our goal is not to call and ask about their compliance.
This is
Our goal is-
the only way.
Nice
he's gonna
spin,
get
nice twist again.
care.
No, I
This is the
understand
only way
that.
he's
So we're
get-
gonna let them know that he would like to video the recording of all his care when he comes to their campus.
I
And if
have
he
a-
allows
I have
them.
Can I switch that a little bit? Would you request the videotaping policy from each of the institutions prior to even putting out, wasting Dr. Macrosy's time?
I
That
went
would
back to
save
you.
that,
Yeah,
that would be a lot faster and
we won't have to go through the rigmarole because it'll be there.
let's play this in a hypothetical. So we find,
Oh, please.
we call UCSF,
Mm-hmm.
and we say, what's your videotaping policy? And they say, we don't have one.
right.
Or they say,
Don't allow.
uh,
Anesthesia's here for this.
well, Ben Lockman was gonna
Excuse
come
me.
over, yeah, you might wanna. So, or they say, A, they say, we don't, videotape, we don't
Right.
have one. B, they say.
Better, that's worse than having a
We
bad one.
say, yeah, we have one. Do you allow patients to videotape their care? Yeah, sure, no problem. That would be a good thing.
That would be the correct thing.
Okay.
Right.
And if they say, we don't allow videotaping, no way, no how, that would be a problem.
That's a
That's
big problem, right.
Well, it'd be an incorrect policy and it'd be illegal.
So I have no idea.
Oh, wouldn't this be a
What
good learning lesson then,
we
Doctor?
would find out there.
Yeah.
It is. It's an interesting.
Thank you. Let me
So-
shake your hand because, you know, we want things to get better.
So I'm envisioning one of several things going to happen. We find a couple of them that
Don't have a policy.
don't have a policy. We might find one that says, have at it, and we might find one, if we find one that says free reign,
Uh-huh.
that is acceptable to you, then it would be my job then to find a surgeon at that institution that would be willing to
Wonderful.
accept care.
We're on the same page.
Okay.
That is beautiful.
But I think you're right. I think
Very
the first stop
eloquently.
is to,
Yes.
what happens if,
All of them
All
are
of
breaking the
them?
law?
I don't want to go into all the if in, but let's say we find one, nobody has a policy out there that says, sure, patients can videotape.
We don't know that.
But if they don't, but they have no policy, that's still not what you want, right?
Well, as long as they'll accommodate his patient rights and, they may not.
So in a center that had no policy, the question for them would be then, would you
Can you
allow
ensure that your staff is
this gentleman to
And
Right.
create a policy, a correct policy,
or
because you don't have one.
create a
Okay.
policy around this?
Yeah,
situation?
correct.
Okay.
Second is ADA representative at each institution. So there needs to be one readily available.
There should have been one here, yeah.
We still haven't met one. I've been, we've requested it multiple
ADA
times.
is an American Disabilities Act?
Correct.
That is correct. There
I'm
should be
disabled.
A representative to ensure patient advocacy. Instead, we get risk managers under the guise of the experience, and that was disappointing. But
But
that's
expected.
not why we're here.
May I
So,
scribble on
Oh,
that?
that's yours.
Okay.
sorry about that.
No, that's okay.
So that would be step one. Step two, we have been trying to request a complete copy of his medical chart in the event that this gets no resolve and he does need emergent care. I need a copy of his records from here, from his
I don't
visit on August 3rd.
I can't imagine that would be a problem.
Mhm.
Well, I've asked Jeff on multiple.
We'll get a copy of
Okay.
his entire medical record.
Okay, and then three, there was a letter that was supposed to be written to his primary care physician to attempt to restore the damage of,
It was a letter to state that he was here on April 11th.
well, it actually
More than that.
needs to go further than that because Zuckerberg said he wasn't here, his physician didn't believe him, and
You
there's
can certainly type a letter that says he was
Okay, I gave
There's
here
Jeff.
on this campus.
Jeff Critchfield.
Yes.
He's
Not
on
only
the
was,
town,
not
so-
only was I here on this campus,
Jeff put a letter in the medical record, a letter of apology in the medical record that just appeared between
okay,
Thursday.
I'd love to have a copy of that. And does
Just
that,
get that
and does that
copy.
letter also state that it's not illegal to videotape? Because he needs to know that
I
too.
don't know, but when it-
Okay, so
Okay,
we'll,
one step at a time,
yes.
that's, thank you. So I did email Jeff specifics on what the letter needs to address. Essentially, he could probably even copy and paste what I wrote in order to address the needs that Jason requires. In order to start rebuilding that relationship with his primary care physician, because his primary care physician right now says videotaping his treatment is illegal.
So it's a letter to the primary care straightening him out on this? Is
Yes.
that pretty much?
Well, and to confirm that
I was here
he
seeking
was
emergency
here
services.
seeking emergency
And that I was assaulted. What happened that day says,
Right.
says that it's verified.
There's no record of
There's
him
no record
because
whatsoever.
he was assaulted and escorted out.
I didn't see any emergency room. I saw no records. But
There
this
wasn't
is in
a-
April, right?
Right,
Yeah.
4/11.
Not a record of his
Right.
visit here.
There's not a record.
Correct.
Yeah, and is that normal policy?
I can't speak to that.
You can't or you won't.
I won't.
Thank you.
Perfect. Okay, so that's 1, 2.
ADA rep policy request videotaping from other facilities.
Mhm.
Letter to the doctor.
The medical records, request for all the medical records. Letter to the primary care regarding your visit on 4/11 to the ED.
Right, and has Jeff sent you what I sent him?
I've gotten a copy of, I don't know if I got your correspondence. Jeff sent me a summary from your conversations since I
Okay,
was out here.
that's kind of risk management phrase, so we do have a response to all the
Okay.
items, which I can send you later this afternoon. I know it's a lot, and I appreciate your willingness to at least look at it. But there was a short and sweet kind of, here's what the physician's letter needs to say. I can forward that to you today
Sure.
too, actually, so that this is ready and available tomorrow morning with his medical record packet.
Because let's say I don't get it into the place that you're going to send me right away. I can go back to my physician, start building the trust, and these other things. I can be working on that end too.
Right.
You know, I
And having
mean,
his primary care physician understand what came
And
out
you can
of
give me
last
advice.
out of last week's emergency visit. He hasn't even looked at the results of the CT scan or anything like that, so he doesn't know what's going on with Jason.
The primary?
Yes.
Yeah, because he will not go back to him until he has that letter from Jeff or Zuckerberg in his hand, because Zuckerberg, rightfully, because Zuckerberg told his doctor that he wasn't there and that videotaping is illegal. So that's what this guy is premising his care with Jason on, and it's not good at all.
Well,
I went
it put
with
me
him.
over a barrel for 3 months.
Right.
You know, I mean, let me ask you a question, doctor. When you go back and you look at these videos and you realize that I've been seeking my health care off and on here for 5 years, and 3 months ago I was denied, and probably a year before that I was illegally arrested at Tom Waddell following up on my health care, and 2 years prior to that I came in, you know, with you know, my P showing how ill I was and everything, and was denied emergency services. You know, when you go back and you look at all that and you tell me I now have a cancer diagnosis,
He's got a process.
maybe, you know, had everything happened correctly, you know, this could have been addressed so much easier and I wouldn't have gotten this out of hand. You know, when you look at the videos, I want you to tell me what stone I didn't overturn, what I could have done that any logical, sane human being could have done after everything I did and all the places I went to. And now, who's suffering the consequence? Apparently, it might finally be admitted that the law was broken, but, you know, who suffered the consequences in the meantime? You know, and the only reason I suffered the consequences, doctor, is because apparently I'm willing to die for my principles. Whereas everybody else would put down the camera, would bend over backwards as soon as you or her or anybody else who they thought was authoritative was telling them the truth. Or shall I, let me put it in ways that you can understand. The city attorney has spoken. It is gold. It is the rule. It is the law of the land. Our ass is covered. So, you know, this is just more of the same. Ask me if I've heard back from the city attorney, you know, regarding the prior things. Ask me if I plan to hear back anytime within my lifetime, you know, amount of time if we're dealing with the city attorney. So, you know, from a professional point of view, being a doctor, being a gentleman like myself, I think you can tell I feel played.
I can tell.
Thank you.
It's going to be a long time of people doing the right thing.
I'll believe it when I see it. They're just going to go back to what they were doing, because you know what? Until you verify, it's all meaningless words. Yes, we corrected it. Yes, we did this. Yes, we... Would you like to see my letter from Gene O'Connell? Anytime somebody walks in, signed 20 years ago, they will receive a triage and a medical screening. Oh my God, isn't that the same principle? Apparently, I guess I must be dead right again. Words are meaningless.
Let me just run through.
Yes, please.
My notes.
Yes,
This is
please.
The
Pretty
list.
please.
List. So policy regarding videotaping.
Rescinded.
From these, either is this
Oh, this is about... Okay, yeah,
either
you're right.
rescinded here. If they rescinded the policy, use the words rescinded.
DPH
DPH.
rescinded the policy.
Yes. If
Yes.
they did that, would that work for you here, or
Yeah, all
do we
throughout
still have
DPH,
is
the
trust-
entire area.
So that would work.
Yes.
Yes, yes.
Barring that, review of policy at these other institutions,
Correct.
assuming we can find one that has
The correct policy.
the policy that's correct.
Sorry, had to throw that out.
ADA rep,
Yeah.
Correct.
copy of medical records,
Needed if I'm transferring.
letter to primary doc confirming your record of visit and all of the other
The videotape and
information.
I'll
everything else.
email Susan
Correct.
specific.
And then the last would be us making transfer arrangements,
Correct.
assuming DPH doesn't rescind and we find another institution that has
Yes.
correct.
Well, you know, sir, I would love to take a gentlemanly bet on it if you're about DPH rescinding. Oh, I love the chuckle. Thank you. Thank you. That spoke eloquently to the whole thing, because I would be more than willing to place a gentlemanly bet on it. You know? Sorry.
I'm not a betting man.
In this case, I don't blame you.
Did I get everything?
Yes. Is it, well, Jason? Is,
I
Is
yeah,
that-
I think it's like 90%. If there's something else we can that we've missed, we'll contact you, but that sounds like the gist of it. I think that's
Yeah.
correct. I mean, I can't think of anything off the top. Can you, Doctor? I mean,
And-
we're crossing our T's and dotting our I's.
No, I would just hope we can get through this quickly, because the sooner
Well, I agree with that.
we get you the care you
I
need.
totally agree with
better
that.
off you're gonna
The only difference between us is I have no hope anymore.
Yeah, I do, I guess.
I do too.
Hopeful.
Well, put yourself in my shoes. See how much hope you'd have.
I know.
Yeah. You have to walk a mile in my shoes.
Okay,
Okay.
so we have marching orders. I'll email you the two things that I was working with Jeff on for Jason.
I believe Jeff is back on Wednesday as well. so
Yeah.
hopefully between now and then we'll.
I want to thank you all from the bottom of my heart for
so-
being here and for all of this. Because I will always do the right thing.
Okay, so shall I wait?
I'll work with
We'll
Dr.
talk.
Percy.
Okay, and then we'll be the point of contact.
You have my email
Conveying.
on the card?
Yep. And then I'll be your point of contact and we'll talk. And records, I'll be back at 9 a.m. tomorrow morning.
Okay. Diane, can I get it? Am I going through Diane to contact her?
Sure.
Okay. A telephone number? I'm sure you've already given it to some folks, but.
415.
Mhm.
Well, Jason, you gotta stop recording. I don't want this on